Hi, John. Welcome to the Power Talk Show powered by Business Talks Weekly. Thank you so much for accepting our invitation and joining our podcast or channel today. Before we dive into a conversation, can we talk a bit about your professional background and what led to the creation of LumaFlex?
Well, thank you so much, first and foremost, for having me on the show. Very excited to be here. I appreciate the opportunity to share. I've always been in fitness, and I was always a competitive athlete as I was building fitness businesses. But with those sports that I was playing, I played rugby and I did amateur boxing. I sustained a lot of injuries, and some injuries were quite severe. And my wife introduced me to red light therapy to help with these injuries. And that's where I discovered the power of light, using light as a natural healing remedy. But the device I used in my career as an athlete it was cumbersome. It was something that was difficult to use. It was effective and it worked, but it wasn't the design of it wasn't something that I felt could really excel the exposure of red light therapy. So I designed a product that was more suited to someone like myself that was on the go, that wanted a durable product that was powerful. And that was about 7 years ago. So it's been a long journey of learning about light and also creating a product that I feel really can be a game changer and create consistency and help people with not just athletes, but anybody suffering from pain, and offering a natural remedy, a natural pain solution. Because in the world right now, especially in the West, we see a lot of pain medication being used, right? We see a lot of surgeries that perhaps can be prevented, and light is natural, it's non invasive. It's a very easy thing to at least try to address your pain before looking to more invasive surgeries or medication. But yeah, this is a very long story that went on for many years, because there was the discovery phase about light, then there was a development phase for the product itself. And then 2 years we've been launched for LumaFlex. And this product has won 11 awards in design and
Wow.
innovation. And actually, in December, on the 4th of December, I have an award in Dubai that I'm getting for a natural, non-invasive pain management solution. I'm getting an award in Dubai at the end of the year.
That's wonderful.
It's been a very long journey. Lots of it is learning more about natural healing and seeing how natural remedies can change our human condition. And it's also been a challenging journey, building the business, building the product, launching, lots of travel, lots of, deals. And it's
That's great. And thank you so much for sharing that with us. It's fantastic. I want to understand, how does it affect the body? How does the healing process work through red light therapy? How does it affect? And are there any scientific backed evidence that it actually works?
Yeah, the clinical research for light therapy and the human condition right now, where we are, and in this day and age, it's very significant. I have access to a global database of clinical research to support light therapy and the human condition. And right now, we're close to 1,000 studies to support light therapy. And these are for conditions that are very serious, like Alzheimer's, Parkinson's, dementia, some conditions which we think there are no solutions for. Clinical research is now showing that light therapy can actually help these conditions. And the way I always like to discuss about the science of light therapy on the body, I want to package it and make it easy to understand and easy for somebody to talk about to their friends and family, because then we raise awareness and we make the world better, right? With natural healing. So think of light. Light isn't something made in a laboratory with some crazy scientists that are tinkering around. It's from the sun. It's from, the multivitamin that's given to us on this planet, which is the sun. If we were to rewind during, these ancient times or Bible times, or just these times in our early history, we had a lot more exposure to light, to the sun, than we
Absolutely.
do now. right? So they say that we're about 95% deficient in sunlight in this day and age compared to, the times before. So we're getting less light, and this is not having a good effect on our bodies. There's a lot of mental illness now is a big topic, right? That people are suffering. And it's all because we obviously, our biology, we are creatures of light and we need the light to heal, but we're very deficient in light. We spend most of our days inside concrete jungles with artificial light. Artificial light can be actually create inflammation in the body. So when you think about that, you can see that there's a deficiency in sunlight. We need tools to help us get the light that, to help our body. Now, sunrise and sunset, like places like Thailand or even the UAE and Dubai, you see that beautiful sunrise. That's red and infrared light. Later throughout the day, other rays of light, other wavelengths come into play, which can be harmful for our bodies. But sunrise and sunset, that is red and infrared light time for us. And we take specific nanometers of specific wavelengths from that time and we program them into LEDs. And the LED, so this particular device that I've got, this is a 630 and 850 nanometers. So these two wavelengths are programmed into that LED, and they provide red light, which goes about an inch into your body, and they provide infrared light, which goes about 4 inches into the body. Now, though that light reacts with your body's mitochondria. We are, as human beings, we're made up of cells, and think of the cell as like, it's like the F1 car. I love F1, by the way. So I always have F1 analogies. And the engine of that F1 car is the mitochondria. That helps drive the car, it helps drive the cell. So the light is giving energy to the mitochondria, and that allows the cell to do what it's supposed to do. So but this results in increased ATP, cellular energy, increased blood circulation, and a reduction in inflammation. All very important things when you're looking at chronic pain, or even for hair growth or testosterone production or skin rejuvenation. That's why light, it has so many outcomes. There's so many benefits, from beauty to pain, right? Or even for men. Men right now there's a lot of caps and hats, these helmets that
Yes.
help you can grow hair. And it's all because you're giving energy to the cell, and then the cell can perform. It can do its job. So it's not really the light that heals you. It's the light giving energy to the cell to heal you. That's the simplest way to understand it. To when if someone sees or engages with products or with podcasts or talks, and it's to do with light therapy, think of it as cellular energy. So if we're powering the body's cells, anything up from there, there's a lot of outcomes that we can achieve, right? Think of it like your cell phone. Your body's the cell phone, and the light is like plugging the cell phone in. And now we can use all the apps in the phone, right? So it's mitochondria energy. But yeah, that's it. That's the simplest way I can explain it.
That's very interesting, and I'm learning so much about light and the innovation that you are building into it. So I want to understand, John, what goes into bringing such a product into the market, from the design aspect and even to federal guidelines, medical guidelines, what goes into building such a product?
Yeah, there's obviously, I'm very passion driven as a person. I don't usually build a company and start a project unless I'm very passionately involved in it. It means a lot to me, and my history as an athlete and suffering pain was a big driver and gives me a lot of motivation and determination to build the business. But there's with every country, it is a medical product. So it's FDA cleared. We have Health Canada. I have the China FDA as well. I'm also working to get the medical license for the Middle East, because that's a market I'm very passionate about. I like the uptake in the whole GCC region, the interest in wellness, in health.
Absolutely.
very inspiring. And there's a lot of regulatory things that you have to cover. There's a lot of these challenges, you have to overcome them because it allows the product to be trusted, to be guaranteed, and the customer feels confident that it will help them in whatever condition that they have. And right now, where my passion for the rest of the year is the GCC region. I've gone to Dubai and Riyadh many, many times, and I thoroughly enjoy that area. So I really want to launch more and work with partners there more. And then the other region is Asia. My wife is Chinese, and we have a good partner in Singapore, Vietnam, in Hong Kong, in Japan. We've got a great partner, and China as well. I want to. This is a market I'm very interested in. The company
That's
is
very
based in Miami, and we're quite well known in the US. But I like the up and coming markets, where interest and excitement about wellness is, and that's Asia and the GCC.
absolutely. And it's an open market. And, the more you are exposed to this market, the more scalable your business becomes. I want to understand, John, like, you are a wearable device. Is there any plan, or do you currently have any app which will give you the insights on how the device is performing and how you can enhance your performance through the device?
I'm so glad you asked that. Yes, I'm building an app. So I've got an app that pairs with the LumaFlex. The in the because when you have a medical product, and where red light therapy is in medical products, we have to be cautious about making claims. I can say red light therapy does this, but I can't say LumaFlex does this. LumaFlex has this.
Absolutely.
So yeah, I have to operate in a very safe area. But definitely the app, what I've got now with the app, I offer the education. You learn about light therapy. All of that is available on the app. You can connect this particular device to the app, and you can introduce something very special. You can introduce frequency of light, because when you have the device on, your cells can become saturated. You don't get more benefit, and you don't get less benefit, but you kind of flatline. If you introduce frequencies of light, the cell can breathe. So your uptake, your intake of light therapy can be optimized. So I've introduced a slide bar where you can have different hertz, and these hertz relate to clinical research. So, for example, there's a study about PTSD. Some people suffer from PTSD. It can be very traumatizing mental condition, right? And if you set the hertz at 50 and you do treatments of 50, so this is 50 hertz. I'll show you the how it looks. You can actually support mental conditions by introducing hertz. So that is something that I'm very interested in doing, is pushing frequency of light. So this is now 50 hertz. You can barely see it flickering. So
Yeah.
that's something that's in the app. And having protocols using hertz, which wavelengths, because you can pick red light, infrared light, or both, and giving a protocol, but still staying in the safe area for regulatory. So if somebody says, I've got Alzheimer's, I can't say, like, LumaFlex can help your Alzheimer's. I can say red light therapy is known to help support Alzheimer's. This is the treatment protocol you can do.
Yeah.
Still, like, there's always that legal regulatory side, and it's like I have to put on the LumaFlex cap, but then I also have another cap, which is a light enthusiast cap, right? Where I just have to do the wording right. But all of those protocols are coming into the app very soon. It's very exciting.
Wonderful. Wonderful. That's very interesting. John, you are a pro athlete, and turning from pro athlete to coming into becoming a founder and entrepreneur. How has that journey been for you?
Yeah, it's good because I think athletes, we have an aggression. We have this thing, we want to fight, and we want to take on
Yeah.
challenges. Right? But for me, I suffered a lot physically, especially with with boxing. Boxing, after 4 years of competing in amateur boxing, I started to get very severe headaches. And my wife pushed me to have a scan of my head, and they found a tumor. The tumor was about this big in my head. It was about the size of my thumb. And the doctor told me it was caused by traumas to the brain, and I should not do any more boxing, like no more impact sports, which for me was okay. I can't. Rugby was impact as well, but rugby broke my shoulders and my left knee. That was the, it was very,
My God.
so I still have that, that competitive, spirit, but I'm trying to transfer it more into the business, and building a team and winning every day with, with milestones in the company. I think every athlete there's that time when your body is finished and you can't do more, and you have to make the decision to compete in another area, and business is good. You can bring that passion to business and fighting for growth and changing the world.
Absolutely. So, what has been your biggest learning so far, John?
Definitely to be more calm and more processed. Probably this
You cannot be
transition.
aggressive like you are in business.
Exactly. You can't be a yes man. You can't say, yes, I'll figure it out and try to like break through the door. You have to knock on the door, slowly open the door, and then everything must be more calculated. There's a phrase where it's jump off the cliff and learn how to fly on the way down. You can't really do that because you have a team, you have a company, you have partners. There's a lot of people relying on you. So a more processed approach, more detail oriented, more cautious, double checking everything. That's what I've learned the most in this transition. With sport, I would just say, oh, I'm ready, let's go. I would just do it and learn how to do it on the way. But you can't do that so much in business.
Absolutely. What one final question to you, John? Who are you supporting? Red Bulls or Papaya?
Okay. All right. All right. Okay. So I like Max Verstappen, but I'm not a Red Bull fan. I like Max. I like Max aggression, his zest.
Absolutely. He's
But
competitive.
my favorite team has always been Mercedes, always been Mercedes. And I like that because of Toto, the leader. I like the
Yeah.
the team principle. I like the way he is as a leader. And I really look up to him in some ways about how he leads the team, how he deals with the downs and the ups, and he's consistent. But right now, it looks like McLaren is doing really well, right? McLaren
Dominating.
is crushing it. But I've always been like how I would envision myself and how I want to be in the company is like Toto and Mercedes. They're very by the book, they have principles, they have a good structure, a really good team. They're very, I just really appreciate that team. But then Max, is just this aggressive wild horse, that knows no fear. And I appreciate that too, that athlete, in him.
Thank you so much, John. Thank you so much for accepting our invitation and joining us. It was a wonderful and delightful conversation. I have learned so much. Thank you so much.
Thank you. Wonderful. I hope to be in Dubai soon.
Definitely, we will catch up whenever you are here.
Excellent.
Thank you.